Hello everyone, today I'm going to be talking about vitamin C, also known as ascorbic acid. I think most people, when they think of sources that are rich in vitamin C, automatically think of citrus fruits, particularly orange juice. There's some other good sources such as sweet peppers, strawberries, broccoli, which is even better with cheese sauce. And I've listed, or I will show you, the RDA for men and women and pregnant and lactating women. Keep in mind, if you're a smoker or people that smoke tend to need greater amounts of vitamin C. At toxicity levels, we typically see symptoms such as osmotic diarrhea, which usually occurs at greater than 2 grams or 2,000 milligrams per day. There's some also, I'll talk about some other toxicity issues in just a moment. Vitamin C technically doesn't require digestion before it's absorbed, so that makes it unique. Absorption typically occurs in the proximal jejunum, so the second portion of the small intestine, right at the beginning of the jejunum. And as intake increases of vitamin C, the absorption actually decreases. So when you take in approximately 1 gram of vitamin C or 1,000 milligrams, the absorption of that dose is actually cut in half by 50%. So more is not always better. And it's transported primarily in free form in the blood. High concentrations of vitamin C are found in the pituitary, white blood cells, the eyes, and the brain, as well as in the adrenal glands. Within 6 hours, excess vitamin C is excreted in the urine. So I think you've probably heard people say, how expensive is your urine, meaning how many types of supplements are you taking that are water soluble that are excreted, and vitamin C again is going to show up within 6 hours if you're taking it in excess. In terms of toxicity, as I mentioned, osmotic diarrhea, abdominal pain, oxalate stones may be seen in people who take it in doses at 2 grams or higher. If you've ever had a kidney stone, I'm told it's very painful, so that's something you would want to obviously avoid. With high doses, there may be issues with people who have disorders of iron metabolism. Also, certain lab tests it may interfere with. Now, excess vitamin C above 250 milligrams actually may cause a false negative hemoccult blood stool test. So if they're looking for blood in your stool, and you're taking 250 milligrams of vitamin C or more, you may actually have blood in your stool, but the test is showing up as false. Just the opposite occurs with a urinary glucose dip test. If you take high doses of vitamin C, the test may be a false positive when actually there isn't glucose in your urine. So those are things that you do need to be aware of. Deficiency, the one disease that we see with vitamin C deficiency is scurvy. I've listed some of the characteristics of scurvy for you. Hyperkeratotic hair follicles. You actually have deposits of keratin along the hair follicles, and they kind of look like goosebumps. Petechia is hemorrhaging of the small vessels, typically around the eye area or actually within the eye, within the sclera. Bruising, you get ecchymosis, which is these purple type patches on the skin that are very unpleasant looking. Swollen and bleeding gums. The gums can, and actually necrosis of the gums, meaning the gum tissue actually dies. The swelling of the gums can actually occur to the extent that it makes it impossible to swallow food or liquids. So it can be very extreme. Typically with scurvy, you may start seeing symptoms within a month, but usually full-blown in 4 to 5 months. Impaired wound healing is a major problem. Of course, vitamin C is involved in collagen synthesis, bone fractures, and also impaired immune function. As I was mentioning in terms of mechanisms of action, it is a co-substrate. There's 3 hydroxylation reactions that occur or are needed for collagen synthesis. For carnitine synthesis, it acts as a reducing agent in our hydroxylation reaction. Tyrosine catabolism, which is often used for energy production. Vitamin C plays a role, as well as in the neurotransmitter synthesis of norepinephrine and in microsomal metabolism. Vitamin C is also a very powerful antioxidant, which I believe many people are fairly familiar with. It reduces the number of reactive oxygen species and serves as an electron donor. If you happen to be taking non-heme iron, which is the iron that would be prescribed by your doctor, it's often given with vitamin C to enhance absorption. Some of the cereals that you'll see advertise that they have iron, they're iron fortified, but they also contain vitamin C to help with that iron absorption. Sailors became deficient in vitamin C during their long voyages, and a physician discovered that if they sucked on limes, that they wouldn't have the symptoms associated with scurvy, and they of course became known as limeys. I think that's something probably that most people learned in history class. I have several articles for you to read that I must confess overlap with my interest in forensic science, particularly in forensic anthropology. And there was an early settlement in St. Croix, which is an island between Maine and Canada, where anthropologists found evidence of scurvy in the skeletons when they were excavating the settlement. And one of my favorite professors, Dr. Marcel Sorg, actually was part of that excavation. And what's interesting related to what we're talking about is there's actual osteological forensic evidence of scurvy in the skeletons that were found there. So take a look at those and see what you think. And let me know, as always, if you have any questions. And we'll see you soon. Bye-bye now.